This is a case illustrating IVUS evaluation of a left main stenosis. A 71-year-old male was admitted to the hospital due to unstable angina. His only coronary risk factor was diabetes mellitus. This RAO caudal view shows an intermediate stenosis in the distal left main. However, the spider view does not show any distal left main stenosis. Two IVUS pullbacks were performed, one from the LAD and one from the left circumflex. The bifurcation segment is called the polygon of confluence. This IVUS pullback is from the LAD to the left main. The first diagonal branch appears at 3 o'clock, and then the left circumflex appears at 2 o'clock. Note the eccentric plaque opposite the diagonal branch and opposite the left circumflex that is greatest between these two branches. This IVUS pullback is from the left circumflex to the left main. The LAD appears at 7 o'clock. The lumen looks the most stenotic at the bifurcation where the LAD is also seen. The plaque extends into the distal left main. These still frames summarize the two pullbacks. Note the lumen area measurements in yellow. Shown in panels B, the minimum lumen area in the distal left main was measured as 6.8 square millimeters in the LAD pullback and 7 square millimeters in the left circumflex pullback. Shown in panel C, the minimum lumen area in the POC was measured as 6.4 square millimeters in the LAD pullback and 6.1 square millimeters in the left circumflex pullback. This is a comparison between IVUS images obtained by directly imaging each branch compared to the oblique views obtained when imaging the opposite vessel. As shown on the left, the severity of the disease at the ostium of the left circumflex is not clear in the oblique view from the LAD pullback. However, direct imaging of the left circumflex shows severe disease at the ostium of the left circumflex. A similar finding was seen at the ostium of the LAD, as shown on the right. We will now repeat the two IVUS pullbacks. This IVUS pullback is from the LAD to the left main. The first diagonal branch appears at 3 o'clock, and then the left circumflex appears at 2 o'clock. This IVUS pullback is from the left circumflex to the left main. The LAD appears at 7 o'clock. The lumen looks the most stenotic at the bifurcation where the LAD is also seen. This case summarizes the difficulty in assessing a left main stenosis by coronary angiography. Angiography may underestimate the severity of left main stenosis, such that IVUS has a Class 2A recommendation for left main evaluation. IVUS assessment of a side branch ostium from the main vessel pullback is only moderately reliable. An MLA of at least 6 square millimeters is the most acceptable cutoff to defer revascularization.